Hello, everybody. Here's Sabine at English for Nurses. I got my right t-shirt on. It's Florence Nightingale with the flow. Go with the flow. It does say go with the flow. And the flow of today in this little education video, I would like to share a very important question with you, which I come across during my workshops. I teach clinical English to nurses, midwives, doctors, and all healthcare professionals. Let's start immediately with the patient admission. You start to speak about yourself as a staff nurse. My patient admission is always with my character in our handouts. Her name is Mrs. Shamila Khan. So, and I would ask her, my name is Sabine, and I am your staff nurse today. This is how I start my shift. When I go into my nurses bay to greet and my patients, who am I? This is a very, very professional and actually also a very warm welcome. So they know exactly who you are and they know you are the one who's looking after them during your early shift, your late shift, or your night shift. In the handover, the nurse's report, it's called handover, a nurse's report, you would get all the patients information, everything is going on. You get the full name of your patient, you get the date of birth of your patient, you get the resus status. Is the patient, yes, down for resuscitation or not? You get the diagnosis, symptoms, why are they here, and also the past medical history, anamnesis, we call it, amnesis, and also what kind, obviously, of nursing duties we need to undertake. When I go through the patient admission questions, there is always this question: do you suffer from serious illnesses or diseases? Let me just write this for you. Do you suffer from serious illnesses, diseases, or sicknesses? Yeah, at the moment, now, or in the past, which is done. Or maybe it's a chronic illness, asthma, COPD, diabetes mellitus. You all know it. And as nurses, if we get the answer of yes, nurse, I suffer from diabetes or asthma, any chronic pain, ulcerative colitis, Crohn's disease, there is always a question, and this is a very important question for our great colleagues who are working in the emergency department, but also for us nurses who are working on a ward, on a surgical ward, on a medical ward, on an orthopedic ward, gynecological ward, oncological ward. When we realize that there might be some symptoms, some presentations of the patient that we think the patient has got a cold, which is not an influenza, we could ask the patient like this: do you have a cold? A cold. The patient might have to cough. Do you need to cough? This is coughing. Do you need to cough? Do you need to sneeze? To sneeze. Do you need to sneeze? These are checkups. Yeah. If the patient doesn't necessarily have influenza, maybe the patient just has a cold. The cold is the word here which you need to ask. Yeah. The word cold, especially for us not native English speaking healthcare professionals, can mean this symptoms, but also mean when we feel cold, then we use the word cold. Do you feel cold? Is the opposite of warm. Do you feel cold? We use also this word. So think about it. Do you speak about the cold where the patient feels he or she needs to cough? There is a cough in the throat. It goes into the airway area, a really hard, strong cough coming from the lungs. Yes. Or is this going also included the nasal area to sneeze? The patient has to sneeze. The word here is cold. For the German-speaking colleagues, for nurses or healthcare professionals from Germany, Austria, and Switzerland, the German translation is here Erkältung. Okay? Erkältung in English is the cold. As when you think your patient has a cold, you can also ask, do you feel cold? Because most of the time they feel cold. Do you feel unwell? Is also very important to check it. Where do you feel unwell? Do you feel unwell? And if we check the temperature, if it's a very, very bad cold, with the cold, there is also a sore throat. Do you have a sore throat? Do you have a sore throat? So they have problems. Yeah, the tissue inside the mucus is red, maybe inflamed. Yeah, irritated is the mucus inside the throat. Do you have a sore throat? This is also very important to ask. Do you have a sore throat? Sore throat for the German-speaking healthcare professionals is Halsschmerzen. Yeah. These are very important sentences, questions which we need to ask our patients. This is only a little clip here this time, but during the last few months, the last years, when I teach the patient admission in English, there is always a questions from the nurses, from the midwives, from the doctors. How can we ask a patient about having a cold in English? Because most healthcare professionals, they say a cold is the flu, short form for influenza, but it's not. It can become the flu, but a cold is not necessarily influenza, as you all know. Okay, I thought I'd drop this video for you and it will help you to do the little symptom checker and about having a cold. The patient needs to cough. The patient needs to sneeze. The patient has sore throat. The skin is aching. The skin is hurting. And most of the time, not every patient has a headache. Do you have a headache? Yeah, it's always called headache. Do you have a headache? It's also very important to ask this. Write it down in your little notebook for further clinical terminology or non-clinical terminology. If you want to learn more about clinical English, colloquial English, drop us a line, sabine@englishfornurses.org, or visit our website www.englishfornurses.org, or as a little freebie now, every third Thursday each month for 90 minutes we speak and discuss healthcare matters in English. If you want to join a fantastic community of nurses, midwife, doctors, physios, students, come along and meet us via Zoom, 5 p.m. till 6:30 p.m. UK time, 1800s till 1930s CET, Central European time. All of these information are out on our social media channels. We are, of course, on Instagram. We are on Facebook, LinkedIn, and wherever you can find social media information. Okay? Keep up your great work. Florence and I say goodbye and see you soon. Bye. Bye bye.